Good postures to do with the pelvis. Now, I'm going to use my model for this video. So here I've got a model of the pelvis and the spine. So we've got the spine, the back of the pelvis, the front of the pelvis, and right up at the top here we've got the back of the skull. Now, in some cases, I talk about gapping the pelvis. And what I mean by gapping the pelvis is that the pelvis is moved in some way, shape, or form. So there's essentially a fixation, something that's stuck on one side of the sacroiliac joints, this area here, and perhaps something that's more pulled round as a response to that. How does this happen? It happens because the pelvis is a bowl, and it literally, there's sort of two elephant ears that make up the pelvis. Elephant ear 1, elephant ear 2. And what happens is they're connected both by the sacroiliac joints on this side and the pubic symphysis, or the symphysis pubis, right at the front, which is a little sort of disc of cartilage. What happens is that this bowl literally moves as a bowl as well, and it articulates both of those joints. It's held in place by muscles, ligaments, connective tissues, and there's some quite complex joints in play here. The pelvis is also an attachment point for lots and lots and lots of different types of muscle as well. So there's lots to talk about, but in essence what I want you to think about is a cocktail stick in a rubber band. And if you think about how your bones, your muscles start to work, is if something is tighter on one side, things start to pull, right? So if things are tighter and things are starting to pull this bowl across, what it's like is a bit like a jellyfish or a crinoline dress. Things start to just sort of push and shift. And so what happens is that the pelvis comes inwards on one side, starts to create more space, and as a result of that, this side of the pelvis shifts across and creates less space. The effect of that might not be something that you'd see on an X-ray, but something that you'd feel in terms of the muscle tone and tension, and can create restrictions in movement, not the least if there is inflammation involved. And so what we do is we try and get this to be realigned, and certainly that's something that we do as chiropractors. But there are some things to note. The first thing is there are certain postures that we naturally try and adopt because they feel better for us, they feel good to us, and they try and short-term gap this pelvis. A lot of this is okay short-term, but long-term it can create a few issues. Things like long-term lunges. So pop quiz time. The reason why a bar is called a bar is because the bar underneath the bar is something where you should be resting your feet on. The idea by resting your feet on that bar means you twist your pelvis slightly, put your hands on the back of the pelvis and feel it twisting, you'll see what I mean as you're raising your leg up. And as a result of that, you start to gap the pelvis, you create a little bit more space. So where things are more restricted, it suddenly feels better. And the idea for bars, although call me cynical on this one, is that you stay at the bar for a bit longer, you drink more, you spend more money. And there are other examples. So things like when you're sleeping in bed, you might sleep with one leg open to the other. So again, that will twist one side of the pelvis a little bit more than the other and creates that artificial space. But what happens is you're starting to pull those ligaments, muscles and connective tissues, and you may also be, depending on what's going on, be pulling that symphysis pubis or pubic symphysis as well, just as those bones articulate differently. So a lot of the advice that we give in clinic is to be mindful of how you use your pelvis. And most of us don't or aren't mindful in how you use or mobilize your pelvis. For most of us, I'm going to do some weird hand movements here. For most of us, we walk, we move our pelvis forward and back, or we're sidestepping and moving from side to side. What most of us don't do, however, is move like this, moving like this. And so hula hoopers, people who move their hips from side to side, you might see me do this if I'm talking at an event a lot. These motions are normally quite unnatural for most of us, especially blokes, if I'm honest, because our pelvises don't move in just the same way as women's do. So what you want to really do is get the most out of that motion, rocking back and forth, moving from side to side. And it doesn't have to be huge, it can be just a little bob here and there, just to encourage the weight to distribute across those sacroiliac joints and to basically wiggle things out. It's a bit like the old-fashioned school shake it out type of thing that we used to do, just to encourage that things move as nicely and as easily and as efficiently as it can. This is a good sort of fail-safe basic if things are really sore. You can just sort of do this little bit of waddling. It's almost as if you've got a child in your arms and you're waddling from side to side. But again, you need to go from side to side. When you're waddling with a child, we don't necessarily twist. So it's sort of side to side like this type of thing, which looks like some sort of strange dance, but it's it tends to be a useful motion and movement to do. Now, we can certainly give exercises and stretches in clinic if there is a restriction in this area, as well as adjust, of course, and there are lots of other things that you can do as well. I'm not going to put them on this video, but it just gives you an idea of what's going on behind the scenes. If we're discussing that with you and we're talking about the pelvis being restricted or gapped, this is what we mean essentially. The idea is that we should get things to be a little bit more even, so that things aren't pulling quite so much around the pelvis, because then it makes those restrictions. This is completely different, please note, to a radiological misalignment or subluxation or whatever, in the respect that those terms tend to mean bone completely out of place. Here what we're just saying is things are a little bit functionally less than it should be, rather than things are actually completely out of place. So I hope that's been a useful video. It gives you that little bit of extra information behind what we mean in terms of that pelvis being stuck and how we mean by it being gapped. And there are certain postures, as I mentioned on this video too, which are good for that position and also not so good. And a lot of the default positions and postures we adopt tend to feel good in the short term, but actually can make it worse in the long term. So that's why going to see somebody like me as a chiropractor, it's a really profound thing to do, but it should give you just that little bit of direction in terms of what is right for you. And of course, one size doesn't fit all, so it's good to have the consultation. I'm going to see a professional who knows what they're talking about, because then they can ensure that what they're giving you is the right thing at any one time. One of my biggest pet hates as a healthcare professional is people resort to Dr. Google. They look at what they should they think they should be doing, or they ask lots of questions to their friends and family, and while sometimes that's good advice, more times than not that's not tailored advice, and it's really good to get something that's more in line with what you need. Hope that's been a useful video. Take care.